Welcome to the Stress Free Dentist Podcast. I'm your host, Dr. Eric Block. As always, I want to inspire, entertain, and educate you on the best tools and technologies out there. My goal is to help make your practice and career more profitable, efficient, and most importantly, more enjoyable. And check out all of my nonfiction and children's books on Amazon, and check out the stressfreedentist.com for any upcoming events. And if you're feeling you're a dental professional that's burnt out, or you just feel stuck or want to get to that next level, visit the International Academy of Dental Life Coaches or www.iadlc.com, and we'll get you matched up with a life coach that understands dentistry. I also wanted to thank our amazing sponsor, Equa Marketing. They have helped me and my practice over the years to improve with SEO and website performance. And to find out how you can make your practice dominate in your area, go to www.equa.com/MSMSFD to book your complimentary meeting. Again, that's www.ekwa.com/MSMSFD. All right, everyone, welcome back to another episode. And today I am joined by Dr. Jaclyn Tomsic, who is an oral surgeon. And we're going to get into all about her story. Jaclyn, how you doing today?
I'm doing great. Thank you. Thanks for having me. Happy to be here this morning.
And where are you zooming out of today?
I am zooming out of the great state of Ohio, Northeast Ohio, Cleveland. That is where I am located. Also happens to be where I am from. But as we were chatting, we reminisced. We both went to BU dental school. So you're back in Beantown, which sometimes I'm jealous about because I do miss it.
And so did you go to dental school there as well?
That's where I went to dental school. I went to dental school at Boston U. I went to residency in Detroit, actually, at Wayne State University.
Okay. So you went to Boston Dental School, Boston University, Goldman Dental School, and then after dental school, you did an oral surgery residency?
I did. Directly after dental school, I did a GPR in Charlotte, North Carolina, because that's when I decided I wanted to do oral surgery. So I got into GPR, and from my GPR, I matched into oral surgery up in Detroit and was there for an integrated 6-year program. So I did everything, residency and medical school. So yeah, it was great. It was fun. I loved it.
Okay, I'm going to go back here and find out, how did you even decide to become a dentist?
Well, I was always interested in the sciences and healthcare. I really didn't know what I wanted to do. Nobody in my family is in healthcare at all, doctor, dentist, nothing. I really liked my dentist, my hometown dentist growing up. Now that I've moved back to my hometown, I actually started going back to him again. So that's how much I liked him. I worked for him for a couple summers. So, that's kind of what drew me to the dentistry path. I did go to undergrad at a place called John Carroll University, which is here in Cleveland with, going in pre-dent. I knew that I was going to apply to dental school, which I actually, did. So that's how I kind of got into dentistry. I never thought of oral surgery until probably whatever rotation, I guess, third year when you're in the pre-doc oral surgery clinic, you do your oral surgery rotations. Like I went up there. I remember it was the 4th floor when I was there, I'm pretty sure. And I liked it. I was like, wow, this is fun. And then luckily, well, we were kind of there at the same time. So you might actually know Dr. Moore, Dr. Figueroa. I don't know if those names ring a bell, but
Sure.
like those two were really like, I don't know, they liked me for some reason. They jumped on me and were like, you need to be an oral surgeon. We need more females in the field, and it's a great field. And so then I was like, okay, I never thought of it before. And here we are. I didn't decide until late. So I didn't even decide until 4th year. So I had missed already by then, application cycle and all that, which is completely different now from what I understand, than when we were doing it. So that's when I did my GPR. So I decided to do a GPR to kind of introduce me into the hospital system, which at the time was accepted. Now, if you talk to residents, it's all that you have to do an oral surgery externship, which was a thing when I was applying, but it wasn't as big of a thing, I guess, like wasn't required. So I did a GPR for a year. And during that year, I applied to oral surgery and I stayed to this day. I'm very lucky because I matched, and here I am.
Now, if you could have, would you have just gone right into oral surgery if you had done everything on time and decided a bit earlier?
I mean, yeah, probably if I could have, but I mean, I look at it, a year wasn't really that big of a deal. So still had to go to dental school.
Yeah, and it's a GPR or an AEGD. I feel like at least one extra year is, I think, crucial after dental school to figure out, what you want to do and hone your skills. And then the matching process after the GPR, what was that like? And why did you choose the 6-year program versus the 4-year program?
Sure. So I believe the matching program process is still very similar. Today, it's still through the ADA pass, I believe, and you basically have, which is nice, you have a centralized application that you submit all of your information to, and then you pick which programs you want to apply to for them to send it to. So you do that, then you wait for interviews. You go on them. And then the match day for oral surgery is always like the last Monday in January. So we have to like submit our rankings by December sometime, and then our match day is whatever that last Monday in January is. So that's kind of the process in a nutshell. There's a lot more detail to it, but that's kind of like the brief overview. And then I was very strategic. When I decided that I was going to go into oral surgery, I did decide that I only wanted to do the 6-year medical degree route. That kind of goes back to high school, I guess, a little bit, because I kind of went in between dental school and medical school. I wasn't really sure.
Mm-hmm.
And I realized during dental school and oral surgery, applications, I really did enjoy medicine. And I just wanted that. I was weird. I wanted to go to medical school. So I didn't even want to give myself an opportunity, because there's programs that like you can do it at the end, different things. So I was strategic in what I applied to. I only applied to the 6-year programs that had it integrated in. For me, that was great. I mean, for me, I wouldn't have done it any other way, because personally, I wouldn't have been satisfied with myself if I hadn't achieved the medical degree along with it. I use it every day. I feel like it completely enhances, my practice, my knowledge base. That said, 4-year programs are very acceptable. I don't, discourage anybody from that. I always tell people it is a very personal preference.
Mm-hmm.
And if it is something that you want to do, the 2 years really, because a lot of people are like, I don't want to do 6 years. I don't want to do 2 more years. That's just too much, which is, I mean, I will say this. When I went into dental school, I remember saying to myself, well, dental school, I like it because I don't have to do a residency after this. I can just go out, start working. And then I decided to do the longest residency that we can ever do. but that's why I say, like, when I decided to it, I was like all in. And to me, it wasn't like 6 more years of like awfulness. It was like, this is what I want to do, and this is what it's going to take. And I tell anybody, residents who ask me, I'm like, you're not going to understand this now, but 6 years goes by literally in the blink of an eye. Like, you don't think about it and it's over. So that's what I tell people. Like, if you want to do it, because you're never going to have the opportunity to do it again. And it really isn't that much longer of a time when you're really in the thick of it. You're just in it.
And to go from private practice, if you've been working for a couple of years, I know many people that do go from private practice back to specialize in a residency, but I just felt personally like I had to stay in that school mode. And if I
Yeah.
went to private practice, I would not go back to school. That was me
Yeah,
personally.
that's hard. Yeah. I've had some people like reach out to me, and just recently, actually, I had someone reach out to me who's in private practice, and only a year or two, but they think they want to go to oral surgery. And I'm like, that's awesome. But I'm like you, I was in school mode. That's why I went to like the GPR. I was like, I can't go work because it's very hard to go back. I mean, you have to really want it, which is good too, because if you're going back, that means you really want it.
And now tell me, after the residency, um, did you associate for a while? Did you work in a hospital setting? Did you open up your own private clinic? How did that work?
Sure. So I am just an education junkie. I actually did 2 more years of fellowship, 3 more years actually, technically, of education type years before I actually went into practice. So I did directly after residency, I did a fellowship with Dr. Jeff Posnick out in Washington, D.C. at Georgetown. If you're in the oral surgery field, he's a very well-respected, well-written. I mean, he's published multiple journal articles and texts on cleft and craniofacial surgery and orthognathic surgery. So I spent a year with him basically doing double jaw surgery, which was awesome. And then I still didn't know what I wanted to do in life for some reason. So I decided to stay in DC. Well, I wasn't ready to leave DC. That was kind of a big part of it at the time. And I took a PGY2 position as a general surgery resident, which is like absolutely insane that I did this. If I talked to any other oral surgeon, because everybody hates general surgery, but I liked it. So it was like a filler year. Again, did I ever need it? Absolutely not. Do I regret it? Absolutely not. It was, again, I am an education junkie. I learned so much about surgery. It increased my surgical knowledge base that much more, and I'm very proud of it. So, and then after that, I was like, okay, DC is expensive. It's really, I don't want to live here. So I went to St. Louis, and that's where my first job was. I did a year of a final fellowship type, kind of like trauma TMJ type thing. But I knew that I was going to stay at this practice. This practice kind of sponsors this fellowship. So I worked for the first year as a fellow, but then I joined the practice, the group. And I was there for the first 5 years of my career. It was a full scope practice. It was a hospital-based practice. So we were taking, trauma call and doing hospital OR cases, which for me, like what you kind of said couple minutes ago about, going into private practice and then going back into residency. That's how it kind of is for me with oral surgery. I felt like if I got out of the hospital, which a lot of people do, it'd be very hard to get back in oral surgery. So I never wanted to lose that. Something that I still, pride myself in to this day, staying connected with the hospital. I have hospital privileges. I do, take consults and take call at a hospital. So I try, and I still take cases to the OR, not as much as I used to, obviously as a resident or a fellow, but it's still an important part of my practice that I don't want to lose. So.
And now, how do you split your time typically? Do you own your own private practice?
I don't own at the moment, although it's in my thinking about it, I guess is how to say it. But right now, I'm just an associate. I work for a couple different people. I'm an independent contractor. Work at a couple different offices right now. So I basically split my time between the offices. I'm basically in an office-based sitting most of the week, most of the time, and then I just schedule OR cases as they come. And kind of do it that way. I don't have like a block time or anything like that. But I also, like I said, I do take call at a hospital for oral surgery. It's not a trauma center, unfortunately, but they get oral surgery stuff. Sometimes they get trauma. It's nice to have that connection for me because it's nice to have your medical colleagues to refer to like, consult on, and to have them, because as oral surgeons we see a lot of medically complex patients anymore. I mean, we don't get that many, our wisdom teeth patients are the ASA1 healthy people, most of them, but a lot of our other patients are very medically complex, so we really need to know all that stuff and be up to date on that stuff.
And what's a typical day like for you? Is most of the day, is it wisdom teeth, implants? What are you typically doing in a day?
I mean, that would be the bulk of it, as we call our bread and butter in oral surgery. It's summertime, so it's, as many of us say, it's wisdom tooth season. So, it's very typical to do a handful of wisdom tooth cases in a day, in a morning. but yeah, so wisdom teeth, implant cases, but as you know, I mean, you're a dentist, I mean, even if you don't place implants yourself, you're aware of just how much the implant world is just growing. It's not just single implants anymore. It's, multiple implants, full arch, which I do full arch. I've gotten into that in the last couple years, really kind of getting into that. I mean, it is very exciting. It's very life-changing. But it's also, again, it's very taxing. It takes a lot of planning. A lot of the patients are not healthy. But yeah, so my typical day is wisdom teeth, extractions, just extractions of teeth in general, bad teeth, failed teeth, abscess teeth, multiple teeth, dental implants. I also do a decent amount of pathology. I get at least a couple pathology consults a week. Some of them need some type of biopsy, others don't. I do still see some bigger pathology cases as well. But yeah, we mainly do surgeries in the morning, do consults and follow-ups in the afternoon. That's a typical day for an oral surgeon. Because we're sedating patients, obviously, a lot of our patients, not all of them, but a lot of them we're sedating. So we want to do that in the morning. So patients don't have to fast all day, and it's just easier on us, honestly, mentally, to get it done, the stressful part in the beginning of the day.
And do you also do some more complex surgeries?
I do. I will do, like I said, some pathology cases, like big cysts of the jaw, like your amealoblastomas. I don't do as many of those, but like OKC is very common. We see those large dentigerous cysts, so I'll take those to operating room, to nucleate. Sometimes I have to put a plate on them. I don't do as much orthodontic surgery anymore, but I definitely still like to do it and still will do it. And those kinds of cases, a lot of dental alveolar stuff, like the more complex stuff, I take to the operating room just because it's safer. I don't have to worry about the airway. Not everybody's a great candidate for sedation, and even in an oral surgery office. So at least I have the opportunity to take those patients to the operating room where they're more comfortable, where I'm more comfortable, and then you can kind of get it done what you need to do.
Now, as an oral surgeon, what would you say is the most enjoyable part of your profession? And on the flip side, what is the most stressful part of your profession?
The most enjoyable part for me is just the breadth of surgery that I get to do. Because I mean, I like the surgery that I do. I like wisdom teeth. I like implants. I like trauma. I like orthodontics, and every case is different. And as an oral surgeon, I like the fact that I could see, wisdom tooth in the morning, and then a dental implant, and then maybe a biopsy, and then I see consults, for TMJ or for orthodontics or something else. Like, there's just all the diversity I really love. I love the surgery. Wisdom teeth are fun. I just like taking out wisdom teeth. Like, everybody's like, oh, it's the same thing every day, but it's not. Like, even like every tooth is different, even if they're like oriented the same way. I like in my head, like, I'm going to take it out this way. And then I get in there, I'm like, oh, that's not going to work. I'm going to have to do this. Like, it's fun. So I just like the specialty. I like what I do as a surgeon. I love surgery too. Just love it. The most stressful thing about it, absolutely hands down, is the anesthesia, which I also have. It's a love-hate relationship, but like, it stresses us out every single day. Because we all take it very seriously. It should be taken seriously. It does not come without risk any day of the week. It never comes without risk. And so that, to me, is the most stressful part of our specialty.
And now, for you or any of your colleagues, give me your thoughts on burnout throughout oral surgeons. You mentioned, obviously, the most stressful part is the anesthesia. I know a lot of general dentists and other specialists that I speak with are just exhausted. They're burnt out. They're looking for a career change. What are you seeing in the oral surgery field with your colleagues?
Oh, I mean, it's the same for sure. And then you add on, first of all, we've all been to at least 4 to 6 years of residency after dental school, right? So there's that, which is resident life. Like you're up 100 hours a week, there's no sleep, you're on call, whatever. I mean, that there's burnout in that. I mean, so yeah, people burn out all the time. I actually just came back from the chiropractor. So as you know, like everybody in our field, we, are awful on our backs, on our posture, on our ergonomics. Like that's a big, I mean, that causes burnout. I mean, causes early retirement for a lot of people. The first 10 years of my career, I worked 5 days a week. For the past year and a half, I have now really worked 4 days a week on average, which I think is huge for burnout. Because I look forward to that day. Like this, today is my day off. Like I look forward to having just a day. I mean, I am busy. I've been up since 5 a.m. Like I'm doing things, but it's different to get up and have to go to work and do that, and then have like the other just life things that you get to deal with. I've always said, you have to avoid burnout. You can't be all work all the time. I mean, you have to take time for yourself, do other things, do things that you don't have to think about, like mindless things, like whatever it is, like you have to make time for that. If you don't, it doesn't matter what you do, you're going to get burned out if all you do is like live, breathe, eat, work, So it's definitely a thing everywhere. I mean, they talk about it a ton in medicine. I mean, I guess for me, when I say the burnout thing is like, I do truly love what I do. I like the actual work. I think that helps me decrease burnout because I can, I know when I need a break, but I know when I come back, it's going to be hard, but I'm still going to like what I do. So I feel like, I mean, that's so important. That's what I tell so many people who are thinking about oral surgery. I'm like, I'll talk to you about what it's like to go through residency, how to prepare for that, like how to, get through it, that kind of thing. But first you have to decide for yourself, do you like it? Do you want to do it? Because if you want to do it, then you're going to get through it and it's going to be fine. But if you don't like doing it, like people do things, all kinds of things for the right reasons and for the wrong reasons, right? Like don't do it because your dad is an oral surgeon. Don't do it because your parents want you to be this, because it's, you're the top of the chains, so to speak. Some people think, like, don't do it for those reasons because it's not worth it. Like if you don't like it, you're going to get burned out and you're going to hate it and you're not going to be doing it in 10 years. So to me, burnout really, a lot of it has to do with time management and, boundaries, setting boundaries, but a lot of it also has to do with like choosing the right career.
Mm-hmm. Now, what about the challenges that you face being a woman in dentistry, or more specifically as an oral surgeon?
I mean, yes, there are challenges. I mean, the challenges are more mainly in oral surgery. I can't really speak as much for dentistry just because I never really practiced as a general dentist, though I feel like the field is very, I feel like females are very well respected within dentistry. So, but as a female oral surgeon, even to this day, I mean, residency was tough. There were people that didn't want me there, didn't think I deserved to be there, thought I was only there because I was filling a checkbox, I'm a woman. So, there's always the feeling you have to work harder. You have to work twice as hard to be looked at equally. You have to know more than your male counterpart who may be like as dumb as a rock, but he's a male. So whatever he says, like they're going to believe. You could say the same thing, absolutely same thing, and they're going to question you. It's a battle. I will say it's a day-to-day battle. Most of the time it's really very low on my, like I don't battle it every day. You always have patients coming in. I mean, I had a patient, just yesterday that came in and was like, "Oh, I didn't know that you were going to be a woman. I didn't expect to see a woman." And I was like, "Okay, well, my, partner here, he's a guy. Do you want to see him?" No, that's fine. I'm like, okay, I kind of let it roll off in those ways. I mean, there's always going to be those people, no matter what, right? Like people have prejudices, whatever. So, but I guess for me, my passion is just to increase the visibility of women in oral surgery. And we're never, I mean, I don't know if my lifetime like in dentistry and in medicine, like if you look at statistics for, school enrollment, it's pretty much 50-50 now, which I think is great. Which I think was like that even when we were back there. That's what I remember when we were there. But obviously oral surgery, it's like anywhere between 10 to 20% of residents practicing oral surgeons are females. And even though the percentages are increasing, there's more women going into oral surgery. There's still the good old boys club. It still exists. I wish it didn't. I hate it. I mean, I hate to say this, but like I'm looking for them to like retire soon because that mentality is an older mentality. I mean, I trained under them. I mean, I went through it every day, but it's getting less and less, but it's still there. So I just try. I mean, there are days when it's harder, when it really gets me down. I mean, I'm going to be honest. Like there are days when I really not only gets me discouraged, but also gets me very angry. Makes me really mad because I'm a very prideful person. I worked very hard to get where I am. Like I didn't get acceptance into anything. I earned it. Like I went through I applied, I did everything and I got in just like everybody else. I wasn't given any kind of preferential treatment for any reason. And then sometimes almost to be like discriminated against, which I've been discriminated against because I'm a female. I mean, in a department of good old boys. I mean, it happens. So I just work, you have to have you have a very strong mind, which I'm very grateful for. I do believe that I work on that like daily, to believe in yourself and to not let these people get you down because you can, if you let it. And just be that voice and visibility for other females to see like, yes, we are out here, we're doing it. They can knock us down, but they'll never knock us out. And that's probably why they hate it so much, because they know that they will try and they will continue to try. And like I said, hopefully soon in the very near future, all these people will retire, but they also know that they can't get rid of us. They're never going to be successful in that. This is just their way of, I don't know, making themselves feel good. So I kind of look at that and kind of use that as kind of motivation, because I'm like, yeah, like you don't want me to be here, but I'm here and I'm not going anywhere. And you can't take that away from me. So you just got to kind of look at it. It's all perspective, right? And just at the end of the day, like, did you do a good job? Did you help the patient? Did you learn something? Like at the end of my day, like those are the two things. Did I learn something? Did I have fun? And did I help somebody? And if I can check those boxes off, it was a good day.
Oh, that's awesome. That's such great advice, and you're such a great role model. Just one final question: how do we find out more about what you're up to?
Sure. So I am on Instagram. It's Dr. Jackie, spell out doctor, and then Jackie is spelled Jacci. And that's my professional account where I talk about all things kind of like oral surgery and life and everything. I love educating. I also have a website, just jaclyntomsic.com. And then I'm also available by email. If anybody, wants to email me, it's just jtomsic@med.wayne.edu. Somehow I still have my Wayne State email. I don't know. I keep paying alumni dues, so they keep giving it back to me, I guess. I think BU, like it was done like the next week. I didn't have that. I don't know. I don't know where that went.
Yeah, my BU email is long gone. But such a great episode. Thank you so much, Dr. Jaclyn Tomsic. Such a pleasure.
Thank you so much for having me. It's always a pleasure to talk to colleagues, but definitely other alumni. That excites me. So thank you so much.
Thanks again for listening to the Stress Free Dentist podcast. And don't hesitate to get in touch with me at info@thestressfreedentist.com. And if you haven't already, please subscribe on your favorite platform and leave us a review. Until the next episode, I'm Dr. Eric Block, the Stress Free Dentist.